I'm here today with Professor Jenny Weller, who has been the winner of all of the eponymous awards, the Stuart Henderson Award. You gave the Mary Burnell Lecture today. You are the current holder of the Douglas Joseph Professorship.
That's right, yes.
Literally world famous educationalist. I'm interested to know, after a lifetime of education, how did it all start? How did it begin?
Well, in fact, it was, I guess, a little bit serendipitous in a way, in that when I was working at Wellington City Hospital, the head of department there, Stuart Henderson, who's actually the name of the award that I was given for education, he was quite a visionary around the potential for simulation, and he had purchased one of the very first simulators. The METI simulator. It must have been at huge expense at the time. So I was there when we got it out of the box, and it was very exciting times, I think, for a lot of people that hadn't really been involved in teaching, because you could just see the potential of this form of education for engaging people and doing things we'd never been able to do before around addressing the how to do things, not just lectures, not just tutorials, but the actual doing of things, the able to put in theory into practice. So I think that's really what got me into it, and I realised I was doing all this teaching with simulator. I didn't really know what I was doing, so I went off and did a Masters of Clinical Education, and then got really involved in simulation, and then did a doctoral thesis on it as well. So that was the beginning, I think, and it's all down to Stuart.
That's fantastic. David Scott rightly said that it's been a huge amount of work, and implementing your networks program has been a national scheme in New Zealand.
Yes.
For people who are getting started and trying to drive change in their institution or in their organisation, or even at a college level, what advice would you have for how to really implement meaningful, lasting change like you have done with the networks program?
Well, my experience with networks, it hasn't been easy, and if you're trying to actually make a culture change, it requires thinking big, I think, and it requires support. So I think have the big idea, and then come up with a strategy and find your supporters. So to implement this sort of training, it really required strong support from funders. So you needed evidence that this is going to work. So little pilot studies, little attempts, little building up your evidence gradually as you go with sort of your initial training programs, and some good sound bites from people, picking up bits of information about what they've changed. So just collecting your evidence and building towards a bigger strategy. So the networks thing required a massive support structure, a massive implementation strategy. So actually do start looking around things like improvement science, and the lessons that you can learn for how to go about changing culture in a place. Yeah.
For those of us who can't, unfortunately, attend your networks teaching program, what are some things that I could do day to day in my teams, just inside you in theatre, that I can make my team work better?
I think there's lots of things that we can do on a daily basis, and the simulation team training is clearly one thing we can do, but I think it's just starting to think of ourselves as a team. It's not thinking ourselves as individuals. Some days we might go into theatre, or we might even not know who we're working with. So just go in there and say who you are. Make sure that you have a briefing. And if we could get briefings going at the beginning of the day, I think that would make a big difference to how our team work for the day. We're just seeing ourselves as a whole team committed to it. If there's some way that we can introduce debriefings at the end of the day, I think that would be a huge benefit to how we've learnt from the day. little initiatives like, I don't know, you've probably come across the names on hats thing, but this idea that, you know, it is important to know each other's names. Yeah. So there are little things I think we can do to just try and build relationships between the people in theatres and learn how to better sort of talk to each other as a team. Respect, the Operating with Respect program for surgeons. There's a lot of things going on at the moment, so jump in there.
Absolutely. Good advice. Always good advice to jump in. Thank you so much. Enjoy the rest of your week in Sydney and also in Melbourne later in the week. And thanks for being part of our team.
Thanks. Thank you. Good to talk, Bec.